Hi everyone, I want to talk about flu shot. Flu shot. But before going into the vaccination proper, you need to have some background. Many are infected by influenza every year. Many may not be badly sick, but it has killed very many people on a yearly basis. It depends on the variant anyway. There is no natural immunity against flu identified up to now, and last year's shot can sustain you this year. That is why it is given annually. Your body should be ready to fight the flu, but that could be mostly done through the shot you take annually. It is easily passed on to everyone from the affected individuals. In other words, influenza infection is highly contagious. While treating the affected people, it would be wise to gown, mask, and do everything to protect yourself. You should embark on frequent hand washing. Also, the affected individuals should be having frequent hand washing, and the affected people should be isolated, not a sign of disrespect or lack of empathy, but to prevent further spread of the disease. You should cover your sneeze properly, and please do the same while coughing. You can use Tamiflu once it is noticed that this is the situation and people are affected. Then Tamiflu could be used as prophylaxis, but vaccination is the better option when it comes to prophylaxis. Be careful with the use of influenza. You don't need to bother your head about these two medications, zanamivir or oseltamivir, and we'll go over the two of them and have separate presentation on both very soon. When you are given the shot, that is the vaccination or immunization as you may call it, these are the possible side effects. You are likely going to have some muscles where you are being injected, and within the local region, besides the soreness, you're going to feel redness, swelling. You might have systemic infections like fever, body aches, nausea, or headache. Sometimes it could be something more serious like anaphylaxis could set in where people will be having wheezing, hives, shortness of breath, dyspnea, dizziness, swelling in the mouth, swollen eyes, and coughing. Remember, you'll be told to wait 15 minutes at the injection site. The reason is to be sure you are not going to come down with this serious condition that will warrant immediate intervention. Flu shots can have serious complications in some particular age groups, particularly people with less than 2 years and elderly greater than 65 years, also pregnant women or group home residents. And not a sign of disrespect is also common among natives. Complications could also be worse when there's associated comorbidity like liver disease, kidney disease, sickle cell disease in the black race, congenital heart defects, congestive cardiac failure, coronary artery disease, diabetes mellitus with immune suppression, cystic fibrosis, coronary asthma, COPD, immunocompromised, and individual less than 19 years old and taking aspirin on daily basis. Also, some will have very, very severe complications within days to weeks after taking the shot. And those complications could be pneumonia, myocarditis, encephalitis, myositis, rhabdomyolysis, or sometimes in rare cases, even death. We don't give live flu shots to anyone with severe life-threatening allergies to flu shot in the past. For example, anyone who had developed Guillain-Barré syndrome secondary to flu shot administration, no live flu shot, or severe anaphylaxis, encephalitis, or individual less than 18 and is taking aspirin, or any woman in the first trimester of pregnancy. There are three different types of flu shots. You can take the kill one, and some may be able to take recombinant. So it depends. With that, I've come to the end of the first presentation as far as flu shot is concerned. The next presentation will be on the ranking. I mean, we have to stratify who and who can take flu shot. And if we find ourselves in a community where we don't have enough vaccines compared to the population, then we need to select some people who must take the vaccines before the rest will be able to get their own. So the next presentation will shed more light on that. Okay, thanks for listening. Kindly subscribe so that you can get these presentations immediately they're published. Thank you.